Hey everybody, happy Halloween. You know, today is not just the end of the month, today is the last day to celebrate National Physical Therapy Month. We've been doing it all month long. Basically, it's an opportunity to raise awareness to the benefits that so many folks enjoy and receive with physical therapy. So today, we have a special treat. We are going to talk with one of the very best in the business, Dr. Ashley Jarrett. We're going to talk to her a little bit about vertigo, vestibular issues. So if you or anybody you know has ever suffered from something like that, stick around. This episode's for you. Well, guys, welcome back to today's episode. We are thrilled to have Miss Ashley Jarrett with us. Ashley, welcome.
Thank you, Andrew.
Ashley is joining us here. She's one of the phenomenal physical therapists that we have here on staff at Westminster at home. She received her doctorate of physical therapy from Old Dominion. And again, welcome, Ashley.
Thank you. It's a pleasure to be here talking with you today.
And you as well. So tell the folks a little bit. I have the pleasure of getting to work with you and know you from here. Some of the folks out there that don't know you, give them a little bit of a background, who you are, how you ended up here.
So my name is Ashley Jarrett. I do have a doctorate in physical therapy from Old Dominion, as well as board certified for geriatrics. I'm actually originally from the Lynchburg area, and I went away for college and for grad school and just decided that there's no place like this beautiful city and all of our mountains, so I wanted to come back this way. And I have just really enjoyed getting to be part of this community, and I really enjoy getting to work with my clients in their homes where I can really get to know them and what matters to them.
Excellent. Well, you touched on something in there that I had some questions on, so I'm glad you got right into it. Board certified in geriatrics. What exactly does that mean? I mean, obviously we're in a pretty prime place for that to be of importance. How did you end up with that as kind of your specialty?
So I started off working with primarily an elderly population, and with that includes a tendency to have more health problems that are happening simultaneously. And I just loved working with that population. As I went on with that and had been doing that for a few years, I decided to pursue board certification, and basically that means that I've taken a lot of education and taken some very difficult and long tests to show that I have a good understanding of how to evaluate and then work with people who have more than one health condition that's interfering with their function at the same time, and people who may have other things going on with their medications that may also be contributing, and just kind of being able to tease that out and work with them in an effective manner.
Interesting. You bring up a lot of good points for that. Let's take the folks back for a minute and kind of even go into what vertigo is. Again, it's the illusion of motion. It's the issues with balance and gait. What is vertigo and what causes it? Is there such a simple answer?
So maybe not super simple, but we can boil it down to a couple points. Okay. The first thing is really that vertigo is a non-specific term. Really, it just means that somebody has an illusion of movement, or they can feel that they're dizzy. So the first thing I usually ask people is, when you tell me you're dizzy or when you tell me you have vertigo, what does that mean? Sometimes people tell me that they just feel off balance. Sometimes they tell me they feel lightheaded. Sometimes they feel like the room is spinning around.
Wow.
So based on their answer, it kind of starts to give me some clues as to, okay, is this vertigo as in a vestibular or an inner ear problem with equilibrium, or is this related to something else that's going on and making them lightheaded or making them off balance?
Interesting. So just saying I'm dizzy or just saying I'm feeling it, that doesn't exactly. I mean, that could be a number of things. You have to kind of get down to what they're truly experiencing.
Correct. It doesn't necessarily implicate the inner ear just because we're dizzy. Sometimes we're lightheaded because our blood pressure drops.
Yeah.
Maybe that's because of medication, or maybe that's because we're dehydrated.
Yeah.
But, there's lots of reasons to be dizzy.
We may have just watched the Penn State game and it didn't go the way we thought. Craig. So, well, that being said, how does physical therapy, because I mean, if I think, and again, outsider looking in, I think of something like vertigo or needing a vestibular, especially something immediate, is that surgery. But you have therapeutic ways and therapies to utilize. How do you differentiate? Is it a surgical need, or can it be treated with therapy?
So the first thing we're going to come in is talk to you and just ask you some questions. I'm going to find out, okay, when you're telling me you're dizzy, what do you mean by that? Yeah. And then I'm going to ask other questions of like, when are you dizzy? Is there something that you're doing that you can tell is triggering you to make you dizzy? Like, okay, I just walked up the stairs and I'm dizzy.
Yeah.
Or is it, I just bent over to pick something else off the floor, or I rolled over in bed and started vomiting and started feeling like I'm spinning?
Yeah.
Did you just start a new medication? And if so, what the side effects might be.
Interesting.
So we're going to start off asking questions,
Yeah.
and then from there we end up doing an exam and seeing if I can recreate that dizzy feeling. If I can, specifically something from the inner ear, then we can move forward and actually treat for a vestibular problem.
Excellent, excellent. So, and again, always correct me if I'm wrong here. I heard something to the effect of some form of the umbrella term vertigo. 40% of Americans will experience that in their adult life. Are there major categories? I know there's, what is it, BP, D, MDR, what is it called?
All right, so BPPV is
BPPV.
by far and away the most common type
Okay.
of vertigo, if you will.
Yeah.
Especially as we get older, it's more likely to occur. BPV is when people talk about having the rocks or the crystals loose in their head.
Yes.
So essentially our inner ear is built like a gyroscope, and we have big loops on both the right and left side, and those loops tell us whether we're turning or whether we're bending forward or tilting our head one way or the other. The rocks or crystals are in there for a reason, and sometimes they just go a little awry. As we get older, things tend to dry out.
Yeah.
So the physiological glue that holds them in place lets them break free, and they go spinning around those loops, and that creates a sensation of vertigo or spinning and being off balance when we tilt our heads or move in certain ways.
And would therapy for that, is that what I've heard about when I've heard folks talk about the movement treatment?
Yes.
What does that exactly look like? Or is it for BP?
Yes, that's absolutely for BPP. So when we're doing movement treatment, it's called cannula 3 positioning is the fancy word.
That is a fancy word.
But on our treatment, we basically put a patient in positions to see which position or which direction of a head tilt actually reproduces that dizzy feeling.
Interesting.
Once we do, we know which one of those canals or loops the crystals are out in, and then we can actually do a series of maneuvers to kind of roll and flip and get the crystal out of the canal.
Wow.
And when that happens, it's a mechanical problem, it's a mechanical solution. We usually get resolution really, really quickly.
Brilliant. Well, I'm going to brag on you for a half second.
Okay, I'm nervous.
As you should be. You have no idea what I'm about to say. No, I was going on a cruise this summer and was going with somebody that on Monday, we were to leave on a Friday. On a Monday, she came down with this incredible case of vertigo and was afraid on Wednesday we would not be able to go on this cruise, or she at least would not be able to go on this part of the cruise. You came in, evaluated her, started treatment that same day. We were on a cruise on Friday. That's absolutely amazing. And like you say, some are immediate sensations, others are a little bit longer. Everybody wants that immediate sensation and return to normalcy.
Yes.
But what do you want now? Obviously, this is your month, right? This is Physical Therapist Month. What do you want folks to know? I mean, is there a benefit to calling you early or to getting in to see you early? Should they wait till it gets, when's a good time to bring you into an equation?
So I think that's an excellent question, and I think the biggest thing that I want everyone to know is that dizziness is not normal. It can be common, yes, as you said, it's about 40% of people, especially over age 65. But just because it's common doesn't mean that it's normal. So if you are someone that is experiencing dizziness, however you want to describe that dizziness, then it's important to talk to a doctor. And if the doctor knows right away, okay, yeah, your blood pressure is just too low, great. If not, ask for that therapy referral. You want to do it sooner rather than later, because the sooner you get treatment, the less likely you are to have a balance problem and fall and then have other issues.
Very, very good point. It kind of creates a domino effect.
Yeah, we don't want that domino. We want to stop things early and let people move on with their life.
Absolutely, and thank you for helping folks do that.
Absolutely, it's a pleasure.
Happy Physical Therapist Month to you. And remember, just like Ashley said, you always have the power of choice. When the doctor's saying you need some work at home, make sure you guys go ahead and request Westminster at home. They'll write that referral. You'll get somebody as great, if not herself, as Ashley. Thank you very much for joining us.